I would like to introduce you to our panel discussion on the pros and cons of tele-ABA therapy versus in-home ABA therapy. To start, I would first like to give you some background history on this topic. ABA is the most widely used evidence-based intervention for individuals with autism. Starting in the 1960s, therapists have used ABA to help individuals with autism, and since then, many different techniques have been developed. The prevalence of autism has increased dramatically from 1 in 150 in 2002 to 1 in 68 in 2012, according to the CDC. This increase has caused more families seeking therapy, but there has been a delay in families having access to the therapy. This was greatly due to the lack of insurance coverage to make the therapy affordable. According to Autism Speaks, there are now 44 states which have mandated ABA coverage. Although the coverage has helped provide services to many, there is still a lack of services available to individuals in rural areas. Traditionally, ABA services providers provide ABA services in a center, which are predominantly located in urban areas. The lack of service providers has caused long delays in receiving needed services. This has caused families to be forced to obtain extraordinary costs to obtain services or forcing many children to go without needed services. To combat this lack of services in these areas, there has been two alternative procedures to implementing ABA: in-home services and teleservices. In-home ABA services include a technician implementing the programs, which are created and monitored by a BCBA. Teleservices are implemented by the parent or caregiver and created and monitored by a BCBA. Both interventions provide an opportunity for therapy which may not otherwise be available. We would like to debate the pros and cons for each type of service. From our research, we have found differences in the delivery of services, the amount of parent involvement, treatment integrity, and ethical considerations for both in-home ABA and tele-ABA. Our group feels all individuals with autism who would benefit from ABA services should be available to access home services. If in-home services are not available, then tele-ABA has been proven to be an effective intervention and would be an acceptable alternative. Our presentation will be a panel of experts who will be our subject matter specialists. Each of us will introduce ourselves. My name is Lisa Espinoza. I'm doing the introductions and the summary, and I will also be the moderator. I live in Portland, Michigan. I am an auditor for the state of Michigan until I complete my BCBA. My experience includes as an RBT for in-home services and the mother of a 16-year-old son with autism.
Hello, my name is Roger Jackson. I will be discussing the pros for tele-ABA. I live in Northwest Indiana, and I work as a line therapist at an ABA center.
Hello, my name is Alec Davis, and I will be discussing the pros of in-home therapy. I live in Central Ohio and work as an RBT doing in-home therapy for a hospital.
Hi, I'm Chris Merrifield. I'm going to be discussing the cons of tele-ABA. I live in Louisville, Kentucky, and I work as an intervention specialist in a psych hospital with adolescents with autism and behavioral disorders.
Hi, my name is Brianna Crocker. I live in Saco, Maine, and I work as a supervisor for an in-home program at a nonprofit agency.
To start a discussion, I would like to discuss the delivery of services. Alec, can you tell us the benefits of in-home ABA services from a delivery of services perspective?
Absolutely. As Lisa previously mentioned, the delivery of ABA services in the past was most often done in a clinic or center. Delivering services directly to the child in their home or natural environment is a relatively new concept. In-home intervention services are most often provided by trained professionals in the field of ABA. Receiving intervention therapy in a child's home allows them to receive more intervention service hours. The number of intervention hours is important because Pullman and Schweinsberg in their 2007 article found that lower levels of depression were found in parents whose children received larger amounts of ABA services. Since one of our main goals is to improve the lives of the children and parents that we serve, this should be taken into consideration. Corness, Osborne, and Reed, in their 2007 article, also found that children receiving higher intensity services, including higher numbers of implementation hours, showed higher intellectual gain. Higher functional skills, decreasing maladaptive behaviors, and intellectual gains are of utmost importance in ABA, and it is important that we do our best as professionals to provide services that allow a child to succeed. I will now turn your attention to a short video clip displaying in-home intervention services provided by a professional. Good job. Good, that's it. Very nice. As you can see from the video, the professional was implementing the program with the child and giving short explanations to the family that was watching the services being provided. Back to you, Lisa.
These are some great benefits which many parents would want to their children to have the opportunity to receive. I would think the cost of tele-ABA would not cost as much as in-home ABA. Roger, can you provide us with more information on the cost comparison?
You're correct. Tele-ABA does cost less than in-home therapy. An article by Lindgren showed that home tele-ABA costs less than in-home therapy. The article showed that in-home therapy cost almost $280 per week compared to home telehealth, which cost about $150 per week. The study's average weekly cost for 1 week of in-home therapy, the client could receive almost 2 weeks of telehealth. This may be due to the staff cost of home telehealth being less than half of the staff cost of in-home therapy. Here's a video about tele-ABA.
Telemedicine, it sounds like a big or fancy name for seeing your doctor via computer. And it's not a thing of the future anymore. Telemedicine is very real. Dr. David Soria is joining us now to help us sort out the pros and cons of telemedicine. I've done so many stories on this in the last 15 or 20 years about being so convenient for rural residents, right. But now it's very mainstream, and people down the street are using telemedicine.
Well, yeah, I mean, you hit the nail on the head, Rox. I mean, a lot of people think it's futuristic when in reality it's not only here now, it's been around for decades. And like you said, it's primarily been used for that rural outreach. But the reality is what it is. It's the exchange of medical information electronically to be used to improve patient care. And what we're seeing now is not just that electronic information that's being exchanged, but we're seeing some real-time video conferencing that really makes that encounter almost lifelike. So it's very advantageous now, not only for people that can't get to hospitals, but even for you and I that are here that like the convenience and like the low cost advantages.
Okay, so who should consider using telemedicine, and are doctors now allowing time for doing telemedicine consults?
You know, the answer is that anybody can consider using it. And many times it's not necessarily a patient choice. Many times it's just that service that's being offered. And very commonly right now, it could be used for psychiatry or even neurology, where there may be a supply that isn't meeting the demand, and so this is a way to sort of bridge that gap. So there are certain pros, and that is that it is less costly. Doctors can see more patients in a shorter period of time, and many people might even say that the quality is improved, but you can more frequently monitor and things like that. So it is improving that exchange.
Now, I did think though, when you're saying quality can improve, but I thought, but you're not touching me. You're not, feeling me. You're not getting that sense of my overall mood. Is something lost in all of that, Dr. Soria?
Well, again, that's exactly right. When I say improved quality, I mean the fact that you can actually go out, you can see patients more frequently, you can talk to them, you can visualize them, and you can monitor them. And so that in turn can improve quality. But you're right, some big time cons. Number one is you lose that bedside interaction. Very important. You lose the physical examination. That physical examination is very important still today. For example, one of the most common complaints that patients come in with is abdominal pain. Without us putting our hands on that abdomen, feeling that belly, seeing where that pain or that tenderness is, the exam or that interaction is very much compromised and things can get missed. So there is a disadvantage when it comes to telemedicine.
But used properly, it can be a very big advantage to patients and doctors in the medical field in general.
No
That's
question
terrific.
about it. It is a solution to a current problem. That problem may be that the supply isn't meeting the demand, and this is a way for us to achieve that.
So folks at home, you should talk to your doctors and make sure this option is available for some of the things.
Tele-ABA is a great option if you live out of range of an ABA clinic or in-home services. It can also prove to be useful if a child lacks reliable transportation. This is due to there being no need for the client or parent to move to a different location. Tele-ABA can also travel with the client. When the client goes on vacation or moves, as long as they have internet connection, they can still meet with the therapist. This allows the parent to ask questions that could arise in different environments. Thank you for the opportunity to explain, Lisa.
Thank you, Roger. I would like to also display the graph, which refers to the cost savings that you were referring to, so everybody can visually see that. The cost savings of tele-ABA are significantly less. Chris, can you discuss the challenges of technology with tele-ABA?
Yeah, Lisa, and Roger brought up a lot of really good points for some pros for tele-ABA, but for a lot of families that live in rural areas and do not have total access to the services, tele-ABA has been used as a method of intervention for families, but tele-ABA has been shown to be cost effective, but for some families, they don't have the means to afford the technology needed to support tele-ABA services, such as video devices like iPads or laptops, and like he said, a stable internet connection. Some don't even have cable providers. So as a big con, this can add financial strain on families who live on set incomes in those rural areas.
Those are some great points, Chris. For many families, this could make the treatment not a viable option. Brianna, can you explain concerns with in-home ABA services which families may encounter with the delivery of services they receive?
Of course, Lisa. Like Chris stated, there's also a few struggles when it comes to delivering in-home services to children with disabilities, especially in rural areas. The distance between consumers or the office can result in a lack of staffing for weeks or even months. This can also lead to a regression in skills or behaviors. If parents are not able to carry out the treatment plan while there are no staff in the home, the consumer can be affected negatively. The rural areas also cause wait lists to become very, very long. When there are no staff or BCBA caseloads are filled, some children might have to wait long periods of time before even receiving services.
Thank you, Brianna. Those are some important factors which need to be taken into consideration. We've heard the pros and cons for the delivery of services for tele-ABA and in-home services, but there are also factors which impact the parent involvement with both in-home and tele-ABA. Roger, will you explain to us how beneficial it is for parent involvement in tele-ABA?
Yes, I can. In tele-ABA, all interventions are implemented by the parent. This means that there will be a behavior analyst to help develop the intervention plans to help the child, but the parent will be taught how to implement the procedure and take the data. So in order for this to be an effective treatment, parents must be willing to participate in the child's treatment. By the parent learning about and being the one who is implementing the intervention, it allows the intervention to be placed more effectively over a larger time frame than just a few hours of in-home therapy. Thank you for the chance to explain, Lisa.
Thanks, Roger. Parent involvement is an important and essential piece of tele-ABA. Alec, after hearing Roger inform us on how parents are involved with tele-ABA, can you inform us on the benefits of in-home ABA regarding parental involvement?
Yes, I can, Lisa. In contrast to tele-ABA, in-home ABA intervention provides services implemented by professionals from ABA organizations. When behavior services are implemented by individuals outside of the family, this relieves burdens from the family members, especially in many cases the mothers. This is extremely important because Pullman-Schweinsberg also found that mothers with higher involvement in ABA services reported higher levels of personal strain. In keeping with our goal to lighten the burdens of our families, this is very important to consider. Back to you, Lisa.
Thanks, Alec. This is definitely a concern which the families need to look at. ABA is an intensive intervention, which is a large time commitment and seems quite technical to implement, especially for tele-ABA. Chris, can you expand on this?
Yeah, Lisa, with ABA services, a lot of intervention strategies involve trial and error with the behavior analysts and specialists, first modeling specific interventions before effectively training them to the families. Using tele-ABA to teach intervention strategies limits these teachable moments for families because they rely solely on the technology used for the intervention as opposed to that face-to-face training and interactions that you get with the parents and the families.
I can see how this could be very challenging for a family. Even though a parent does not implement the daily programming in in-home ABA, I assume there would be some parent training involved. Brianna, can you describe the parent training and any difficulties which might be involved with parent training in in-home ABA?
Definitely. While having parents less involved can help relieve stress within the family unit, it's also a very important part of treatment. Tele-ABA puts a lot of responsibility on the parents, where in-home puts less responsibility when the parents are not as involved at the beginning, but eventually it will be big for the family. Parent training is a vital piece of in-home services. Once the child has worked extensively with the therapist, the skills will need to be passed on to the parents so they're able to manage their child's behavior in the home without additional support. In rural areas, like we previously talked about, it can be very difficult to get full BCBA support when families are long distances apart or caseloads are full due to lack of staffing. Having parents come into the office to participate in training might not be an option, again, due to distance. Providing parent training is a very important piece of treatment, but it might take a backseat if there's less time spent in the home.
Thank you, Brianna. I can see how this could be difficult piece to accomplish and could be overlooked. While this will complete our discussion on parental involvement, we now would like to change our focus to another important topic, treatment integrity. When ABA services are provided, it is essential to receive interventions which are provided with integrity. Alec, can you describe how integrity is provided with in-home ABA services?
Yes. As some of you might know, treatment integrity is of utmost importance when deciding on an appropriate type of service for your child. Treatment integrity is defined as the extent to which an intervention is implemented as it was intended. Children and clients have the right to receive effective treatment according to Ethics Code 2.09a. ABA in-home intervention services provide families with trained professionals, most often college graduates, to implement these interventions. Better trained professionals providing treatment services are more equipped and therefore increase the overall treatment integrity of services being provided. Professionals in ABA are required to ethically to pursue excellence and maintain competence through professional development according to Ethics Code 1.03. This means that trained professionals are required to stay up to date on new advances in the latest ABA research. College-trained professionals are also more effective than individuals that receive short-term training, such as parents. A research study done in 2004 by Dillinger and Gallagher found that intellectual gains in children are often lower in parent-led approaches to intervention, which is important to consider when choosing the appropriate intervention for your child. Thank you, Lisa.
Thank you, Alec. Those are some great safeguards to ensure the integrity of in-home ABA. With the treatment design of tele-ABA, it appears treatment integrity may be a little more difficult to monitor. Brianna, can you explain further?
Yes, I can, Lisa. Alec, you make a lot of great points. There may be better treatment integrity when trained professionals are running the program, but maintaining that training can be difficult in rural areas. Treatment integrity is very important for in-home programs. BCBAs are not always in the home, so they have to rely on staff to carry out the consumer's treatment plan. In rural areas, staff getting adequate supervision and training can be a challenge. The BCBAs may be carrying larger caseloads, so supervision needs to be divided up between their staff. Because BCBAs have limited time in the field, treatment integrity checks might not happen as often as they should. Monitoring progress and checking in with staff frequently is sometimes the only option, and that could also affect treatment integrity.
Brianna, you have addressed very important concerns which should always be monitored. With treatment integrity possibly being compromised, Roger, does tele-ABA have treatment fidelity?
This is a great question and a big concern for people who have no experience with tele-ABA. The BCBA does create the plans, but the parent is trained to implement the intervention in place of the therapist. When you train the parent to be the therapist, the implementation of the intervention is constant. Whereas when a therapist calls in sick, the program might suffer because in that kind of situation, services are either canceled or a different therapist has to replace the current therapist. This could lead to errors, even though not intentional, of the implementation of the client's behavior plan. An article by Vismar stated that in telehealth, when regarding to autism interventions, had a high treatment fatality. Thank you, Lisa.
There are many factors which need to be evaluated when determining to use tele-ABA and in-home ABA, but there are also ethical dilemmas which can be compromised. Behavior analysts need to be aware of these when they are providing tele-ABA and in-home ABA. Chris, can you explain the specifics, what ethics could be compromised with tele-ABA services?
Yeah, Lisa, and you're right. And there are ethical concerns regarding tele-ABA, specifically Code 3.0, which is assessing behavior. Behavior analysis involves improving socially significant behavior in the natural environment. As behavior analysts, effective behavior assessment, or Code 3.01, medical consultation 3.02, and consent and client records Code 3.05 are usually performed in a face-to-face consultation manner with all parties involved, ideally. With tele-ABA, the confidence of that face-to-face consultation is taken away and client records are discussed in sometimes non-private environments, which puts the personal client information at risk.
Thanks, Chris. Those are definitely concerns which behavior analysts have to be aware of potential problems. Brianna, what ethical considerations should be considered when providing in-home therapy?
One of the biggest ethical concerns for in-home services would be around accepting clients, especially in a rural area. If there's limited staff or if the BCBA does not have the time to provide adequate training and supervision, it might be unethical for them to take on new consumers. This also plays a part in the responsibility to the client, Code 2.02. If the BCBA is not able to provide the services that are expected or at the level that they should be, it could be considered unethical.
Thank you, Brianna. You have addressed considerations which the BCBA needs to be monitoring. Alec, can you specify an ethics code which you would feel could be a major concern with a form of therapy, but could be avoided with the other form? And please provide an explanation.
Yes, Lisa. In addition to treatment integrity, easier and more direct collaboration decreases the risk of harm done by inappropriate applications of behavior intervention services. This applies to the Ethics Code 2.09a, or right to effective treatment and do no harm. When utilizing in-home intervention services, feedback and demonstrations can be done immediately and with the child who is receiving the intervention services. As Roger mentioned, as Chris mentioned, this is an ideal condition that all the members meet together for several stages in the process. Professionals are also able to provide efficient meetings with the families to discuss questions and concerns in order to alleviate any potential harm done. Thank you, Lisa.
Thank you, Alec. Our group provided arguments for delivery of services, including the variations in delivery methods, hours, and cost savings of both home and tele-ABA. We provided struggles with providing services in rural areas from lack of staffing, treatment integrity, and lack of time for services received. We discussed the effects on parents from the under and over commitments of therapy and family stresses of therapy and the treatment integrity for the degree of expertise in services received from professional as opposed to parent implementation. While many parents, when faced with deciding to receive in-home or tele-ABA, the facts we discussed before could be greatly beneficial in helping them make that determination. Each family has different needs and wants, and when making such an important decision, they need to have the knowledge of the characteristics that each type of services will provide for the whole family. From a behavior analytic perspective, there are also many ethical dilemmas which need to be addressed to make sure they are providing adequate services ethically. Our group feels in-home ABA is a better alternative, but if not available, tele-ABA is an alternative which also could be an effective treatment intervention. With the pros and cons for each intervention we provided families will help. We find it helpful in determining which intervention is the best for their fit for their family, and from the ethical consideration we discussed, a behavior analyst can be aware of the dilemmas they may be facing. This completes the panel portion of our discussion, but we would like to take audience questions and from our subject matter experts. Our first question comes from Amy Smith. She asks, how many hours are typically provided when utilizing in-home intervention services? I'm going to turn it over to Alec to answer this question.
Thank you, Lisa. If a child is receiving high-intensity services, they may receive around 40 hours per week of intervention services. If a child needs less guidance, they may receive as few as 10 or less hours a week. The number of hours a child is provided with depends greatly on the insurance company to determine their appropriate level of need. This is done through assessments and other information that is gathered from the BCBA and turned into the insurance company.
Thank you, Alec. Our next question comes to us from John Smith. His question is, how much training is needed in order for the parents to implement the intervention? I think Roger would be the best person to answer this question. Over to you, Roger.
Thank you, Lisa. No formal training is needed for the parents to implement the intervention. All that needs to be done is the BCA has to teach the parent the proper way to implement it and how to track the data. The main thing is the parent must be willing to listen to the BCBA and follow directions. Thank you for the question.
Thank you. Thank you for the insight. Our next question is from Tammy Lincoln. Tammy is interested in knowing what are the startup costs for families and/or insurance companies to begin tele-ABA services? This seems like a good question for Brianna. Over to you, Brianna.
Thanks, Lisa. The biggest startup cost for families would include the cost of the electronic device that would be needed to deliver the tele-ABA services. This could be an iPad, a desktop computer, a laptop. Along with the cost of the device, they would also need access to internet, and that would need to be maintained over time, which would include a monthly subscription. So those would be the major startup costs for tele-ABA.
Thank you, Brianna. Our next question comes to us from Sally Franks. She wants to know how much participation do parents have if their child is receiving in-home intervention services? Alec, you'd be a good person to answer this one.
In the beginning of services, parents are able to have as little or as much participation as they wish in their child receiving in-home intervention services. As Brianna had mentioned earlier, the goal of in-home ABA would be to have the parents take over the implementation of services once the time has allotted. This would mean that parents would be receiving short-term trainings throughout the child's services as to not burden them with all of the responsibility and information that they will need to continue services right from the start.
Thank you for the insight, Alec. Our next question is from Danielle Reed. She wants to know how much supervision is given to my child for in-home therapy. Chris, can you answer this one for us?
Yeah, I can, Lisa. Supervision should be delivered at least bi-weekly. BCBA would either come into the home and do direct supervision with both the consumer and the therapist, or they could also complete supervision in the office, going over the treatment plan and implementing new objectives.
Thank you, Chris. Our next question comes from Tim Johnson. He wants to know what happens if the client moves from the region. Roger, can you help us with this one?
Yes, I can. If the client moves from the region, they can continue to use the same BCBA due to the meeting being over tele-ABA instead of in person. It would be suggested that they find out if there's a clinic or in-home services closer, but they could still use the same BCBA over tele-ABA if needed. So in other words, there would be no change to the child due to the move as far as the intervention and BCBA are considered. Thank you.
Thank you, Roger. We have time for one last question from Jennifer Stevens. She's wondering, if I'm receiving tele-ABA, will the BCBA do the supervision tele or in person? Chris, can you help us with this topic?
Yeah, Lisa, through tele-ABA, services are provided via technological services such as over the phone and with the use of video, such as Skype or other video services. There may be initial meetings in which information and data may be collected in person, but the majority of supervision is done in a non-face-to-face manner. The purpose of tele-ABA is to be able to provide those services and supervision to those who live in areas where a BCBA or a therapist cannot directly come to the home.
I'd like to thank everybody for their questions. This completes our presentation on in-home therapy and tele-ABA, and thank you for joining us.